Good morning everyone. I'm Srivalli, volunteer in Shivi Forensics. Today I will be explaining all the MCQs under the topic forensic anthropology. Before we dive deep into the forensic anthropology's MCQs, let us know what is forensic anthropology. It is the study of human skeletal remains and the application of physical and biological principles to medico legal and legal context. For example, we obtain a bone from the scene of crime. Like the scene of crime can be a mass disaster or any kind. We analyze the bones using specialized techniques to find the identity of the person like age, sex, stature, and race. With this, we will now move into the MCQ part. So, the first question is, who is the father of forensic anthropology? Sir Thomas Dwight is the answer because he is widely regarded as one of the earliest practitioners, also sometimes called as the father of forensic anthropology in the United States, for his pioneering in skeletal analysis used in identification methods based on the bone structure. The second question is, according to Krogman's rank, what is the degree of accuracy for sex determination from bones if only pelvic bone is present? The answer is 95%. In the year 1978, Sir Wilton M. Krogman had stated that for sex determination from different bones, different accuracy rate is present. Using pelvic bone, we can obtain a precision rate of 95%. And also, pelvic bone is the most preferred bone for the determination of sex in humans. But if we have both the skull and the pelvic bone, we can obtain a precision rate of 98%. The next question is, which of the following is known as the study of postmortem changes? The answer is forensic taphonomy. This is a discipline of forensic science where we study what happens to a body after death until the body is discovered. This focuses on all the postmortem changes which will affect the remains, and also we determine the postmortem interval and the factors that altered the body, and we can distinguish perimortem trauma and postmortem damage, and also the circumstances of death and deposition can be reconstructed by this discipline. Moving on to the next question, bones have the ability to provide accurate indications for age determination through teeth and bones. They can be achieved through the options are dental eruption and calcification stages, skull sutures, epiphyseal fusion timings, all of the above. The answer is all of the above because when taking dental eruption and calcification stages, our teeth only erupts and regrows at a certain age. For example, we have milk teeth and permanent teeth. The milk teeth falls down in certain age and the permanent teeth grows. Skull sutures like sagittal, lambdoid, coronal only fuse at a certain age groups, and also the fusion of our bones only takes place at a certain age groups, which is why by birth all the babies have approximately 306 bones and an adult have 206 bones. The next question is, what is the primary scope of forensic anthropology? Generally, we study the skeletal remains of humans to identify the cause of death, manner of death, and the indicators like age, sex, race, ancestry, and the identity of an individual. Also, we can identify the stature of an individual. We can also determine the postmortem interval to identify unknown remains which are either obtained in a scene of crime or by excavations and exhumations in the form of bones. Next question is, out of all the four sutures, which one of the following starts its fusion first? The answer is sagittal suture because when we talk about skull sutures, there are two things we need to keep in mind. One is the ectocranial fusion and another one is the endocranial fusion. The ectocranial fusion is the outer surface of the skull, while the endocranial fusion is the inner surface of our skull. So when we talk about the outer surface, the ectocranial fusion, the metopic suture, which is present only in the newborns, begins fusing first. But when we talk about the endocranial fusion, the sagittal sutures fuses earliest and begins its fusion first. The sagittal suture can be only fusing in the ectocranial or the outer surface of our skull in the adulthood, which is the age group between 20 years and 40 years. Next question is, which forensic technique would help to identify an individual in a case where partially damaged skull is obtained as an evidence? The answer is forensic facial reconstruction. This is a technique or a process that is utilized to reproduce the facial appearance of an individual, and this includes a number of different procedures. Traditionally, this technique of facial reconstruction has only involved the analysis of skeletal details to determine the morphology of our face. For an example, the cold case, the buckskin girl case, or also known as the murder of Marcia King. This has used the facial reconstruction technique to determine or to reconstruct her face, and that is how the cold case has been solved. Moving on to the eighth question. Generally, human skeletal system consists of 206 bones. How many bones are present in the appendicular system? The answer is 126, because when we talk about a skeletal system, we see two divisions like axial skeleton and appendicular skeleton. The axial skeleton, it supports and protects the organs of the head, neck and torso, basically the upper body, which includes the skull, vertebral column, rib cage and the hyoid bone. So in total, the axial skeleton has 80 bones. When we talk about appendicular skeleton, it consists of 126 bones, and this contains the upper limbs, lower limbs, pectoral and pelvic girdle. When we talk about upper limbs, we can see humerus, radius, ulnar, carpal, metacarpal and phalanges. In lower limbs, we can see femur, fibia, tibula, tarsals, metatarsals and phalanges. In pectoral girdle, we can see our collarbones, clavicle and scapula, and in pelvic girdle, we can see our hip bones. Moving on to the next. In case of skeletonized human remains, which of the following features is not of potential use in making a personal identification? The answer is tattoos, because when we talk about the other three like bone disorders, dentitions and surgical implants, these are something that remains static even after a person dies and the body is decomposed. But tattoos, they are only inked on the skin and is present in the inner layers of skin, like the outer layer of skin is epidermis. So in inner layers of skin, the tattoos ink is present, but in skeletons that is not present. So that is why we can never consider tattoo as a use to make a personal identification if the body is already skeletonized. Moving on to the last question. Which of the following is considered as the big four in forensic anthropology? The answer is age, race, sex and stature, because when we take or obtain a bone from the scene of crime, which may be a mass disaster or any other kind, first we will identify the sex of that person using the pelvic bone or the skull, and then we move on to the age using the dentition, the skull sutures and etc. And then we move on to the stature of the person using the femur bone, and then we identify the race of the person using the skull, whether he is a mongoloid or any other race, which is why age, race, sex and stature are known as the big four, and this is also the primary purpose of forensic anthropology, to identify the person's characteristics. This is the end of the MCQ series. Thank you everyone. I hope you all have understood forensic anthropology and its importance in the field of forensic science. Also, I thank Shivi Forensics for giving me this opportunity.